Hello and welcome to my channel, Dr. AK MRCP. Please like and subscribe. So today we are going to discuss a very important scenario. You can read it yourself. There's a 19-year-old patient with suspected appendicitis. The only abnormality is prolonged QT, and you note adjusted calcium to be 2.02. And you're told the patient has two knuckles which look like dimples. BMI is slightly high, which is 29. Now you look at the reports, the lab reports, you can see calcium is low, PTH is very high, and you can see phosphate is 2, and alkaline phosphatase is almost normal, 130. So you are asked to diagnose this patient. So on the basis of the clinical features, it looks like a pseudohypoparathyroidism. So we'll be discussing three important differentials in this case, in this scenario. Number one is pseudohypoparathyroidism. So what is actually pseudohypoparathyroidism? It is characterized by features of pseudohypoparathyroidism, which are shortened fourth and fifth metacarpals, just as in the scenarios described as dimples, short stature, obesity as the BMI was high, and the face is usually round face. So if only these abnormalities are described in a scenario, you'll go for pseudo. But if along with these abnormality you see there is a raised PTH, a high phosphate, and a low calcium, just as described in the scenario over here, you can see the PTH is very high, the phosphate is high, and calcium is low. So this is called as a pseudo hypoparathyroidism type 1A, which is characterized by a high PTH, a high phosphate, and decreased calcium. So this is type 1A, pseudo hypoparathyroidism. In type 1B, you will see just the lab findings of increased PTH, high phosphate, and low calcium. So you will say pseudo hypoparathyroidism. The third very important differential in this case, just as you can see in this scenario, is secondary hyperparathyroidism. Now in secondary hyperparathyroidism, there will be, you can see, increased alkaline phosphatase, which in this case was normal. So now you have, at the end of the video, you can easily differentiate these three uh, things: pseudo hypoparathyroidism, pseudo hypoparathyroidism type 1A and type 1B, and secondary hyperparathyroidism. So you can easily pick on this scenario, and it's a very frequently asked question in exam. Thank you for watching the video. I hope you like it and you're able to differentiate between all these topics. Thank you. Subscribe again, please, and like the channel.